Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well. I want to share an experience I had with you this morning, which I thought it was kind of ironic and a little bit funny and made me chuckle a bit, but it is September 17th, and the reason I want to give you the date is September 17th. This morning, a couple events happened while I was getting ready to come to the office. And they kind of hit home. One was I got something in the mail. I am a board certified general practitioner, family practice, and I'm also certified in regenerative functional medicine. It is a fellowship out of University of South Florida. Actually now the Metabolic Medical Institute has actually certified that program through Howard University. Long story short is, so I'm duly certified in those, and also trained and did residencies in family practice and in emergency medicine. The short of this long story is this. This winter I had to study to retake my recertification for my family practice boards, and the recertification and I passed. Acceptance came in, and I am proud of this. It is funny because now it says that I'm certified to 2026 here. But why I find it kind of ironic, and I was happy obviously, is I had to study very hard for that while I was practicing medicine and taking care of patients and being a family man and etc. It wasn't easy, and it was very stressful to be doing that while I try to live a normal life and work, etc. The important thing is this too, though, is to tell you, because what we do here at Longevity Health Institute is a very personalized, customized approach, full encompassing of your wellness. It is a medically based approach, but it looks at you personally. So whether we want to call it functional medicine or regenerative medicine or anti-aging, which was in vogue about 20, 30 years ago, these are all appropriate, really, terms, but really where the rubber hits the road is when you get personalized attention, customized care, and we're speaking to you individually, and you're not a statistic and you're not a number. You're an individual, and we care, and that's how we treat you. The other thing that happened again, then I was getting ready, same day, September 17th, this morning, is Dr. Oz was on, I believe it was NBC, Good Morning America, I believe, or one of those, the Today Show, and he was being interviewed about something that recently came out, and it was a big media day for him regarding aspirin use and prevention, and where the real data is in 2018. The interesting thing that I wanted to share with you was I was happy that he was talking about this and sharing this with the public, but I want to tell you that I've been sharing this with you, the same data, 3 years prior. And this is often what we give patients. We give you cutting edge things in technology. We're often way ahead of the curve in technology and advanced preventative care and research. And we give you evidence-based results, and everything is based on science and studies. What I wanted to share with you is, and what Dr. Oz was talking to individuals about, was aspirin prevention, how to use aspirin, and what a Dutch and a European study that was large, about 20,000 individuals, showed. But I wanted to show you this, is that this is an article that I wrote in summer of 2015, and you can see this right up here about aspirin, and are we doing more harm than good? And it's my newsletter that I put out, and I've been doing it quarterly for a number of years. But that is about the goods and bads of aspirin. And that Dutch study, and what Dr. Oz was talking about today on TV, was that a study confirmed that yes, aspirin, baby aspirin use is good for cardiac prevention, but the key part is that in elderly aged individuals, it actually showed a lot of data that was harmful and of no help. And so here's the gist of it, and you can look at this up, and I'm sure you can find the excerpt that Dr. Oz was talking about, is that baby aspirin preventatively for cardiac events has been shown many benefits in patients for cardiac prevention, primary care. And what that typically means, and in that study, the mean age was 55, but individuals under 70 actually had benefits cardiovascular-wise, preventatively. The interesting thing, though, is back in this Dutch study and European study that I reported back in 2015, is that when you're older than 70 years old, okay, there showed no cardiovascular preventative benefits, much higher risks, actually fourfold increased risks of bleeding. Actually, a small excerpt of this study showed that about 26% people went to the hospital over the age of 70 with GI bleeding versus any cardiac event. So it was more harmful in GI effects and in bleeding and damage bleeding wise to the GI system and to anything that would be preventatively. And the key age seemed to be 70 and above. Plus, there seemed to be, interestingly, a big increase in cancer. Now, we don't quite know why this is, but it seems that older individuals using aspirin might have higher cancer rates. So again, I find this interesting, but we bring you this cutting-edge information in that millions and millions of people are on aspirin. And so the take-home issue is, the take-home message, excuse me, is that yes, probably if you're 60, 65 and younger, you talk to your doctor, talk to us, bring it up. You should be on baby aspirin, maybe a low dose 81 milligrams, warm glass of water, empty stomach. You'll absorb it quicker and better, or enteric-coated. But long story short is that these may have some benefits and seem to prove that. But you have to look at the individual, and you have to look at, do they have GI history? Do they have bleeding history? Are we, if you're my patient here, are we trying to heal or resolve leaky gut? Because over the age of 70, you might have a cancer risk, and you definitely have a much higher risk of bleeding and GI issues, and no negligible benefit for cardiovascular prevention over the age of 70. Again, we brought this to you in 2015. I'm bringing it to you again in 2018, just like Dr. Oz. But I thought it was interesting, and this was all this morning while I was getting ready to come to the office to take care of individuals. So, maybe yourself included. So, anyway, I hope this is informative. The key message is talk to your doctor. It should be a personalized approach. You got to look at each person individually and rate risk. And of course, we're always open to helping anyone. Share this, please, because you even could help a loved one, an individual, in preventing a lot of side effects and potential damage. So again, this is Dr. Lewerenz, Longevity Health Institute. As always, I hope this finds you well, and keep being well. Take care. Bye-bye.